Dr. Sunanda Chava. Last time I had spoken about angina bullosa hemorrhagica. Today I'll just show you a picture of angina bullosa hemorrhagica. This is on the tongue and it's on the palate. Okay, this is angina bullosa hemorrhagica. It's a blood-filled blister. It occurs only in oral and oropharyngeal area. Okay, now today I'll talk about botulinum toxin. Botulinum toxin, it's a miracle poison used for medical and cosmetic problems. So it's a neurotoxic protein. It's an exotoxin which is produced by bacterium Clostridium botulinum. Clostridium botulinum is a gram-positive anaerobic rod-shaped bacteria. This toxin has both beneficial and harmful effects. It causes botulism on food poisoning. Clostridium botulinum causes food poisoning. Is caused by food poisoning containing Clostridium botulinum bacteria. It is got by eating preserved canned food, contaminated, fermented food. Scott first demonstrated the botulinum toxin injections to correct the squint or strabismus. Botox injections are given by diluting toxin with salt water and injecting into specific muscles. It causes muscle spasticity or paralysis. So when there is any wrinkle on the skin, when the skin stretches due to paralysis, the wrinkles disappear. This is the mechanism how the botulinum toxin acts on wrinkles on face where it is given commonly, widely used. It produces effect in the muscle it is injected. So mode of action. Clostridium botulinum produces 8 exotoxins which are different antigenically. They are toxin A, B, C, D, E, F, G. You have again C1 and C2 under C. So out of all these 8 antigenically different exotoxins, we have the most potent exotoxin is A. All produce effect by blocking the acetylcholine release, which is a neurotransmitter from neuromuscular junction causing muscle paralysis. The effect will last for 3 months. An exclusive knowledge and understanding of functional anatomy of mimetic muscles is essential by practitioner. It acts at 4 different sites in the body. They are neuromuscular junction, autonomic ganglia, postganglionic parasympathetic nerve endings, sympathetic nerve endings, and which release the acetylcholine. So this botulinum toxin, it has one heavy chain and one light chain, and these two are connected by disulfide bond. The peak effect is in 4 to 7 days after injection. Function can be recovered by sprouting of nerve terminals and formation of new synaptic contacts, which takes 2 to 3 months time. The effect usually starts 24 to 72 hours after injection. Using low dose of exotoxin to achieve desired effect and avoiding re-injection within 1 month prevents antibody formation and unresponsiveness for injections. Botox contains 100 units of Clostridium botulinum type A neurotoxin complex, 0.5 milligrams of human albumin, and 0.9 milligrams of sodium chloride in a sterile vacuum dried form without a preservative. The original one was first produced by Shantz in November 1978. It was replaced by a new neurotoxin complex batch BCB 2024, which is 5 to 6 times more potent on a weight basis. So 4.8 nanograms of BCB complex is enough with 25 nanograms of Botox. Precautions after injections. Go home immediately and take rest after injection. No strainful work. No massage for 1 to 2 weeks. Wherever you have injected the injection, you're not supposed to massage the area, because these procedures will increase the blood circulation and the toxin will spread to the other area and produce the effect in an undesirable area. Indications: strabismus, that is squint, facial dystonia, like hemifacial spasm, other spastic movement disorders, headaches like migraine, hypersalivation, then hyperhidrosis, that is increased secretions, Fraze syndrome, hyperhidrosis, that is sweating, chronic anal fissures, facial wrinkles, and there's something called as crow's feet. At the lateral part of the eye in elderly people, there are wrinkles in some people. So that vanishes with botulinum toxin. The effect will be there for approximately 2 to 3 months. So they can be given even for torticollis or wry neck where sternocleidomastoid muscle is affected. So in problem with ticks also they can give, like Tourette syndrome, multiple sclerosis, urinary incontinence. What is the adverse effect of the botulinum toxin? It's usually well tolerated, and usually if it causes local pain, edema, erythema, transient, that is temporary, numbness, headache, malaise, mild nausea, uh, and then other muscle which is not desirable, the effect is produced in that muscle or area. And when to correct the strabismus, botulinum toxin is given in the eye for levator pallidus superioris. So this can cause ptosis, that is drooping of the eyelid. So in these cases, it can be this is one of the adverse effect. So it can be reversed by alpha adrenergic agent like apraclonidine, 0.5% eye drops. If they are hypersensitive to, if the person is hypersensitive to apraclonidine, phenylephrine 2.5% can be used. In dry neck, sometimes the adverse effect is oropharyngeal diffusion causing dysphagia or difficulty in swallowing. In some people who are on aspirin, vitamin E, NSAIDs, the medicines have to be stopped 2 weeks before the procedure. Otherwise, there will be bleeding tendency. There might be flu-like sickness, brachial plexopathy, gallbladder dysfunction as adverse effects sometimes. Contraindications for botulinum toxin injection: motor neuron disease, myasthenia gravis, Eaton-Lambert syndrome, neuropathies, unstable psychological health, hypersensitivity, which is main, pregnancy, lactating females, and careful monitoring in children to avoid axonal growth adverse effect. The drug interactions are with aminoglycosides, penicillamine, antimalarials like hydroxychloroquine, chloroquine, then HCG, calcium channel blockers, blood thinners like warfarin. Some preparations of botulinum toxin are Botox toxin, Dysport, Myoblock, Xeomin, Neuroblock. Some use electromyographic monitoring for injecting the botulinum toxin injection into the strabismus cases, but some don't use. So this is a brief review or brief talk about botulinum toxin. See you in the next video. Thank you. Bye.